Lisa,
Yes, baby girl.
when I grow up, I want to be a menace to society.
Then so shall you be. Hey everybody, welcome back to A Menace to Society. I'm so excited today to speak with my guest. She is the founder of Restore Meditation. Welcome to the podcast, Eleana Conway.
Hello, thank you for having me.
Thank you so much for being here. Now, you used to be a nurse practitioner. Does that mean that you were like rehearsing to be a nurse or playing one on TV?
No, actually, first of all, I am still a nurse practitioner. I still do that as sort of one of my other jobs, one of my many hats that I wear. But so a nurse practitioner, actually, I was a nurse. I was a registered nurse for a few years, and then I went actually back to school to get my master's and my family nurse practitioner, my master's in community health. So it's actually an advanced practice degree. I can write prescriptions, I can order lab tests, and all sorts of good things. I can be an independent practitioner. So I also open Restore Meditation because I believe that mindfulness and meditation are really the medicine of the future and really the best medicine we even have today.
There's a lot of disconnect, isn't there, in the West with Eastern traditions?
I don't know that there's a disconnect. I think there has certainly been in the past, and I think we're seeing growing interest both in the general public but also in the medical field as well as with science. We're seeing so much evidence pour out now for the benefits of mindfulness meditation, really MBSR, which is sort of homegrown from the UMass Medical Center and founding father John Kabat-Zinn. Really, we're seeing meditation have positive outcomes for all of our patients. So whether patients have cardiac disease, ADHD, diabetes, pain, adding mindfulness and a stress management aspect to their care really improves health outcomes. So it's really good medicine, but being in the moment tends to also make us happier. And so we're finding that it's also helping with stress, both with adults, with kids. We're seeing it really infiltrate families and help there, but we're also seeing it in the corporate world. We're seeing that mindfulness not only helps make us happier and healthier, it actually can make us more focused and have more clarity as well as more productive.
Well,
so
how do you...
It's kind of a win-win-win.
It sounds like a win-win-win, but how do you find mindfulness if you're just sitting there with your eyes closed breathing?
So that actually is a misconception about what mindfulness is. So mindfulness, the definition, or the John Kabat-Zinn definition, if you will, is the awareness that arises from paying attention in a particular way, on purpose, in the present moment, non-judgmentally. So really, we can do anything mindfully. You can run mindfully if you're paying attention to what you're doing. You can listen to music mindfully. It's actually not emptying your mind, but actually really focusing your awareness on one thing non-judgmentally. We happen to use our breath quite a bit in mindfulness because it's always with us. It's free. You never run out. No refills needed. There's no side effects. And so when we follow one breath, we're in the present moment. And so it's a tool that we use quite a bit for mindfulness. But people often think of meditation as, sitting on a cushion, levitating, trying to empty your mind, which is actually really not that easy to do. Just like we can't stop our heart from beating, we can't hold our breath, we can't stop our minds from thinking. But we can try to focus our minds on a single point of focus, and that's what mindfulness meditation is.
So what are some things that people focus on?
So, again, the breath is a big one, but, you can actually, a lot of people like to spin, and I highly encourage people to spin mindfully. But it's when you look at the person sitting next to you and start comparing what they're doing where you no longer are mindful, right, because that judgment piece comes in. And although spinning is quite helpful and can really help with our stress levels, if you're at work and your boss is being grumpy and you need stress relief, you can't say, "Excuse me 1 second while I go spin." But you can always pull your breath out. Nobody needs to even know you're doing it. It's sort of your own personal superpower that can help deflect the stress and also allow us to respond skillfully rather than react in that typical stress, fight, or flight reaction, which usually makes things worse, right?
Yeah, you're talking about like detachment, sort of, kind of?
Not detachment. It's not detachment. So, it's kind of interesting you say that because if you think of our emotions, right, kind of like spinning like a storm, we can take on that storm and spin with it. Or we can kind of see our emotions kind of spinning, but, I don't know, like in our right hand, like we're keeping a bunch of saucers going. So we're still connected to them. We still see them. They're still ours. We just don't become part of the storm spinning with it. One of the meditations that we do in mindfulness is really to think about us as being like a mountain. So we sit in a mountain pose. We're strong. We're stable. And we can see all these lovely white, fluffy clouds pass by. Those are our thoughts, our emotions. And there may be very dark clouds that pass through. We can see them and notice them. We don't need to become them. We can still be the strong mountain, just noticing these things passing by. We can remain stable and calm at our core, still while these things pass through. It's not quite detachment. It's still very much ours, and we're still very much gaining awareness. It's sort of a mapping of our mind. Judson Brewer, who is the new director of mindfulness at the UMass Medical Center, talks about this notion of mapping our minds, sort of really figuring out how do we think? What are my individual patterns? What works well for me? What gets me into trouble? And if things are getting me into trouble, can I be aware of that? And then, I don't know, maybe approach it differently the next time.
You're making me feel very calm. I have to be honest with you. I'm thinking all these questions.
That's good. That's a good thing, right?
I'm thinking all these questions, and I'm floating to new questions and floating to new, and I'm loving your voice.
I work with engineers all the time that sit and try to solve problems and equations, and they think they can sit all day. We actually identify with our stress sometimes, right? We think it gives us our edge. We think we're going to be able to get through and plow through because of our stress, but actually our stress tends to make us stupid, right? We're running around late. We're looking for our keys. Where are they? Oh, they're right here in my hand. Stress distracts us. It makes everything spin. Mm-hmm. But when we take a break for 5 minutes, and we sit down, if you're struggling, guess what? Go meditate for 5 minutes and come back. Things will flow so much easier. It gets you into that state of flow, easiness, calm, but really it's the clarity. The clarity that comes through, that we see things. It gives us a perspective. It changes our relationship to the same situation that we're in. It's just a different approach.
I've been meditating for a few years, and I firmly believe it has changed the way I think about life in general and react to situations.
Yeah.
Mm-hmm.
That's awesome. Yeah.
So
once you start doing it, I tell people, give it a month. And people say, well, how much do I need to meditate? I like to tell people the daily dose of meditation is 20 minutes because we know that's the dose to see the changes in the brain for that stress center, the amygdala, to shrink down, and the cerebral cortex, our strategy, sort of higher functioning, reasoning, skilled response will get stronger. If you can do that every day, 20 minutes every day for a month, you will notice changes. You'll look back. They'll be minute day by day, but when you look back in a month and something stressful happens, you say, I would have handled that completely differently. And then people in your life will say, what's happening to you? What are you taking? I want what you have. And they mostly say it's meditation. We don't even know that we miss it until we start doing it. And then if you miss a day, you notice it. You don't slip immediately, like withdrawing from it, but you just notice, you know how peaceful you feel and how calm you feel when you meditate, and you want to keep doing it. It's like after you go to the gym, we feel good. We don't get physical health from going to the gym once here and there. It's when you do it every day that you start to notice changes. Well, meditation is exercise for our brain.
I believe in everything that you're saying. Do you think that some of us choose not to meditate for the same reasons we don't continue to go to the gym? Like you might go for 2 months and then all of a sudden, whatever.
One of the biggest obstacles to meditation is time, for sure. But it's really what we make our minds up to. We all waste 20 minutes a day on Facebook. And I always say to people, I don't know if you can swear on this, but would you rather feel like crap? Like if you can feel like crap for 20 minutes, wouldn't you rather get rid of that and feel good for 20 minutes? So we all have 20 minutes. Mm-hmm. We all have it. It's really about making it a priority, which is not easy. 20 minutes is the daily dose, right, to see those changes in the brain. But we know that the changes happen even in 2 minutes. So even if we need to start with baby steps, waking up in the morning, taking 10 breaths. I have teachers ask me all the time, how can I integrate this in my classroom? Well, it's not throwing it in at the end of the year when the kids are nervous about going to the next year's classroom. It's really about doing a minute of breath every day after the Pledge of Allegiance, so that you're practicing every single day. When something stressful happens, you have a positive habit that you can go to, right? You're not using it for the first time. You can just call on a new skill.
Becomes a muscle.
Yeah, it's a muscle, exactly. Yeah.
It's interesting that you brought up schools, because I did read, oh gosh, it's been a few years back. There was a school in San Francisco. I believe it was a charter school, and it was not a great school as far as what was coming out. Kids getting into fights, test scores were not great. And they implemented meditation every day for the entire student body, and they saw a huge spike in success.
Yeah, they do. It happens everywhere. If you can believe it, I go into a lot of schools, a lot of school systems, the whole districts. But the Catholic Church actually had me come in last month to teach their kids about meditation. So even the most conservative group on the planet, Roman Catholics, like it's really talk about a miracle, right?
Mm-hmm.
The benefits come when we're open. You know, it was really, really positive. Like, it is everywhere. If it's in the Catholic Church, it's everywhere. You know, the only place we're not seeing it, rapid growth, is actually in the hospitals, which is so strange, because you would think that would be the first place we would see it. But I think the hospitals are really struggling in this new world order of, you know, healthcare reform to stay alive and to figure out their financing. And we know that the benefits are there. We know the science is there, but there's just not a lot of funding for a lot of new programs. And so I think in 3 years, we are going to see a much, much different healthcare system. I think the focus on prevention is going to continue and continue and continue. I mean, we now have this new division of mindfulness. Think about that. We have a division of cardiology. We have an endocrine division. We have surgical divisions. Now we have mindfulness divisions. It's got its own seat at the table in hospital systems. It's just started at UMass. They're really cutting edge, pioneering this, and it's going to follow. It's really, you know, it's taken hold. It's everywhere in our culture. It's everywhere in our media. Healthcare is going to embrace it. And I don't see it as a fight between Eastern and Western. I really see it as embracing holistic, complementary, whole person, total person care, you know, prevention, treatment, and keeping people sustained. Healthcare is changing for the better.
I'm very, very inspired hearing that from you, because I'm one of those holistic people that is super crunchy especially when it comes to standard healthcare. And you know, I'm always bummed out that hospitals don't just serve more yogurt, because that cuts down on a lot of infections, especially for women.
I know.
You know what I'm saying? And so many people get the sepsis.
I know. You believe me. I used to run those wellness programs.
Yeah.
But it's tough because it's still a business.
Mm-hmm.
And people want large sodas. People want a muffin. People want a cookie. That's what sells. And, you know, this healthcare reform, we are moving away from fee-for-service and for selling cookies, if you will, really more towards a population health where we're really more vested in caring for total well-being of a person. And I think we're going to continue to see changes in that way. It hasn't happened as quickly, I think, as, you know, we would like. But healthcare systems are not small systems. And, you know, there really are lives at stake. You can't just switch on a dime. You know, some of the schools will switch out a math program and, you know, kids' scores drop for a couple of years and then they pick back up. Well, you can't do that in a hospital, right? So
it's a different outcome.
Tend to, I think, especially now with all of these hospital systems merging.
Mm-hmm.
I mean, the system I work for is 15,000 colleagues. It's hard to make a change in something that big. You know, and I'm not unique. Hospital systems across the country are all, you know, aligning, and to make change is really monumental.
Well, I don't want to ask you about specific patients. Obviously, there's confidentiality systems to think about and consider, and people's right to privacy. But can you tell me one story of someone that you saw in a hospital setting that is maybe working with mindfulness and seeing a big difference in their health?
Yeah, absolutely. I could tell you 100, to be honest with you. But one that comes to mind in particular is a very dear soul who was very new to meditation and skeptical, an older gentleman who had had a heart attack and looked otherwise healthy, you know, actually came to group with his wife, more to support her. And, as we got to talking through the classes, he was having irregular heart rate still. And he noticed when the irregular heart rate popped up, he would get anxious and starting to worry, what if this leads to a heart attack? I mean, he could have been on the way to a Little League game for his grandson when this flutter would come up, and it would stop him dead in his tracks and cause him anxiety, which is pretty, normal and valid, right?
Mm-hmm.
So I said we were going to work on just noticing what was happening and really trying to use the breath when he noticed these symptoms. Instead of trying to wish it was different, instead of trying to make it go away, just notice that it's there and see what happens. So he comes back the next week and he says, funniest thing happened. I would go into flutter and it would stop. Now I'm not saying it's the breath, but I'm keeping my eyes on it. And so I said, that's totally fine. You just keep me posted. You let me know how it's going. By the end of the class, he was reliably and consistently stopping his fluttering heart by going to his breath. Now, this is a man that had had a heart attack. Think of how many emergency room visits he would have gone to with a heart rate fluttering. And he was able, with no medicine, on his own, in control, stop his heart rate from fluttering. That's one story. It happens every day. When people learn that their breath literally can shut the stress response off and turn the relaxation response on, it heals our bodies. It puts us back in the driver's seat. We don't need to worry. Worrying is like jumping on a train with no conductor, right? Where is this train going? Oh, why don't I just get on it and see? We would never do that.
Right.
But we do it all the time with our mind chatter. We follow our worst case scenario thoughts in our head all the time. Once you get a taste, it's really about direct experience. Once you practice and once you see those changes directly in your own body, you know something. It's your direct experience. It's not what somebody told you. It's not a pill that gave it to you. You know something, and then you own it. And you can always tap into it. And it's always been there. That's the funniest thing. We tell kids, we tell people that are stressed all the time, take 3 deep breaths, but we never know why. Well, this is why we've always been saying it. Because this is the way our race is designed. We just got really busy and forgot about it.
I forgot to breathe.
We got looped into technology and jobs and, whatever else has happened to us in the last century. It's pulled us away from our ability to heal ourselves. And we're awakening to that, which is really exciting.
Do you think many of us think we can't do anything to heal ourselves, our bodies, our minds, our broken spots, because we've been told that we have to go see someone, we have to find this specialist, we have to take this medication? I don't mean to say that that's not necessary and important and integral to good health. You, of course, need to see people who are trained to help you, especially with certain situations. But, a lot of us, I feel like we don't have the confidence that we should.
Yeah, and so it's hard for me to be able to answer that because I'm a nurse practitioner.
Mm-hmm.
I come from a family of nurses. My sister's a physician. If I need something, I write myself a prescription, and that's the end of it. I have always sort of had the knowledge base.
Mm-hmm.
So it wouldn't be fair for me to make a judgment on somebody that didn't come from there. I mean, if I didn't have that knowledge and that accessibility and that really privilege of being able to figure it out because I have the science and the resources,
Mm-hmm.
and I had to go to somebody, you have to trust what people are telling you. But with that being said, this is all we've known. The research on mindfulness is only coming out
Mm-hmm.
in the last 15 to 20 years. So a doctor 20 years ago wouldn't have even known to tell you to do this. I think a holistic approach is critical as, if not, an entire aspect if people feel that they can manage their care. If they're well or if they have chronic conditions that way, then I say all power to them. My job as a nurse practitioner, and really I carry that with me into the studio, is really I'm a nurse.
Mm-hmm.
I'm a nurse at heart, and I believe in educating my patients. When we educate people about the science behind mindfulness or the science behind any medication, whether it's a cholesterol-lowering agent or something else, it ultimately is the patient's decision. We as healthcare providers need to be respectful and supportive. It's our job to educate. It's the patient's job to do their part in the self-care too. And so the mindfulness piece actually puts us as patients back in the driver's seat with the ability to dose, if you will, ourselves, our meditation dosage, right, our daily dose, when it suits us, how it suits us. It doesn't have to be mindfulness. It could be kundalini. It could be yoga. Yoga is mindful movement. Again, it's super helpful. You can't break it out when you're, at work, although you might be able to break out some of the breathing types. I'm not an expert in yoga, but we do teach it here at the studio because it really is yoking the mind and the body. The word yoga is the Sanskrit word meaning to yoke, and so it's a bringing together of the mind and the body, pulling those two things together, mindful movement. That's what yoga is.
I want to ask you one last question, because you and I, when we started talking, you were talking about how, just keep breathing. There's lots of oxygen. It's always there. You're never going to run out. I'm paraphrasing because I don't remember, because now I'm so relaxed just listening to your voice and loving what you have to say. I think you're super awake and really cool.
Thanks.
Yeah.
You too.
I'm digging you. And therefore I'm getting a little like womp, womp in my brain. But what about these kids that were stuck, those soccer players that were stuck in that cave in...
Isn't it so great? I actually posted about that, and I used it in my class. How they survived is a miracle, first of all. But this soccer coach was a Buddhist monk. He was a trained monk, and he taught these kids to meditate, and it saved them. It saved them. Instead of getting stressed out and panicking and fighting with each other and being scared, imagine what it must have been like to be hungry. I mean, if I don't eat lunch, I'm a bear.
Right.
Imagine going 9 days in the conditions that they were in, scared, really not knowing if they were ever. Right? You miss lunch, you at least know there's another meal around the corner. Meditation saved their lives. It saved them. That coach is a true hero, and it really goes to show you that the benefits are just endless. They're endless. They really are. Just like our breath, always there. But, that's the thing about the breath is if you get off track, your next breath is right there. Every breath is a new beginning. Every breath is an opportunity to begin again. Every day is a new day. Every stressful event, there's another opportunity to map our minds and to gain perspective and to really respond in a skillful way. And once you get a taste of it, you just want to share it with the world. So thank you. This was a really nice opportunity.
Isn't she great, y'all? Please check out Eleana and her work at restoremeditation.com. That's restoremeditation.com. And there you can find out where to join her on Facebook and Twitter and Instagram. She's especially fond of her Instagram, so please check out that account, Restore Meditation. That's all you have to look for. And please join me at lisalandry.com. If you sign up for my newsletter, you will receive a free audio download. If you subscribe to my YouTube channel, you will know when each new podcast is dropping every Womanist Wednesday. Shout out Ari. Remember when you and I meditated in Sedona? You did good, son. You were quiet for like a whole 20 seconds. I'm proud of you, boy.